at VCBR, which stands for the Virginia Center for Behavioral Rehabilitation.
Right now there's a chart, it's a COVID tracker of all their facilities. It's been, a 50% rate. Just the lack of care is appalling. And in terms of getting them to a hospital, I said they have to be close to death for that.
Twenty states in this country have a system called civil commitment for sex offenders. What it is if you have a sex offense, the Department of Corrections reviews those cases continually to see which ones are about 10 months before their release date. The names of those guys are given to the Attorney General's office, and they look through your file to decide whether they think you might commit a crime in the future. You cannot change your original crime, but they use that to put you there and say that you will do a crime again. It's usually about 60 guys a year. They send you to court for a hearing to commit you to a civil commitment facility. Some get out, and the minimum they can get out is 2 years, maybe 3 years. A lot of them have been there for 10 years.
They put it under the Department of Behavioral Health and Developmental Services to put them in a, unquote, treatment facility. However, they really have extremely little or no oversight.
It's not treatment. It's just really like a prison. They have barbed wire all around it.
It's based, there's no statistics that back it up. There's no data that backs it up. There's no science. It's all based on fear-mongering.
They have about 450 men.
The typical person convicted of a sex offense is usually a white male. That's not always the case, of course. But, however, in the facility in Virginia, 60% of the men are black. A good majority of them have been in prison 20, 25 years, and they're poor.
They didn't have much going on as far as COVID. Well, then about November 3rd, they started finding some cases, and the guy that she talks to all the time, his pod, it's 40 men, and all the men tested positive, and they all were sick, really sick. And this was November 4th. The doctor never came in until November 12th.
It's just almost exactly like what's happened in the prisons. There is no possible way to social distance. Staff at first were not very good about wearing masks. They've had since March, to prepare, and then they've had these massive outbreaks beginning in October. The website says 1 death, but we know of 3 deaths.
And the nurses have been very, very unkind.
There have been guys we've just been hearing this week that have come and said they're experiencing symptoms, and were told by the nurses that there's nothing they could do for them. All the isolation units were full. One nurse came in and said, you need to get in my line if you want your temperature taken, even if they were sick. Serve time is serve time, regardless of the crime. And if the judge at the beginning felt that they needed to serve a longer sentence, then that should have been determined then. I don't think that people realize, or the community realizes, that first of all of these people have completed their sentences. They should be citizens in society. And they have shown recidivism rates among those convicted of sex crimes are lower than any other crime except for murder. And, their families have already tried to support them, and then they have to go through supporting them here because, again, they're treated just as if they were in prison. I personally, I'm a retired public school teacher. Believe me, if this was protecting children, then, I would say, go for it. There's been no reporting on it. Virginia report on every other facility, not just Future, but many people from families and have been calling DBHDS, which is supposed to oversee them. But apparently, like we said before, there's no oversight.
We have tried to get people. The legislators, they just don't want to talk about it. Some of our legislators don't even know this system exists in the state.
where so much of that taxpayers' dollars could go to true mental health, which during this pandemic is so greatly needed. I mean, that our Department of Behavioral Health and Developmental Services is throwing away, $50 million a year, and that's just for the facility, just to run the facilities. There is no prevention in this whole system, and prevention should be everybody's goal, to prevent.